Listen carefully, because what I'm about to tell you will dismantle one of the most damaging myths about female aging that medicine and culture have perpetuated for generations. And if you stay with me until the end, I promise you'll understand why I, as a physician who has spent decades listening to women navigate the second half of their lives, am not just recommending this, I'm imploring you. Before we go any further, I need you to do something. Subscribe to this channel right now, and down in the comments tell me honestly, has anyone ever made you feel like your sexuality had an expiration date? Write it down. Let's break that silence together. Now let me be direct. We're going to talk about masturbation after 60, and I can already sense some of you tensing up, perhaps glancing around to make sure no one's watching your screen. Maybe feeling that familiar flush of embarrassment that we've been conditioned to experience when we acknowledge our own bodies as sources of pleasure rather than service. That reaction? That's precisely the problem I'm here to address. I've been practicing medicine long enough to recognize that the most dangerous lies are the ones we tell ourselves about ourselves. And one of the most pervasive, most damaging lies women in their 50s, 60s, and beyond have internalized is this: that sexual pleasure, particularly self-directed sexual pleasure, is somehow inappropriate, unnecessary, or even vaguely shameful at this stage of life. That our bodies, having fulfilled their reproductive mandate and weathered the hormonal storms of menopause, should now quietly retire from the realm of desire and sensation. Let me tell you what actually happens in my consultation room. Women come to me with complaints they've learned to normalize: urinary incontinence, vaginal dryness so severe it makes sitting uncomfortable, painful intercourse they've stopped mentioning to their partners, recurring urinary tract infections, a sense of disconnection from their own bodies that feels like living in a house you no longer recognize. And when I ask about their sexual health, the answers I hear most frequently are variations of the same theme. At my age, doctor, I figured that was just over. I didn't think it mattered anymore. I assumed this was normal. Here's what I need you to understand, and I mean this with the full weight of my medical training and clinical experience. Sexual health is health. Period. It's not a luxury. It's not vanity. It's not some frivolous concern we're supposed to outgrow. The capacity for pleasure, for sensation, for connection with our own bodies, these are fundamental aspects of human wellness that don't come with an age limit, and when we abandon that part of ourselves, when we accept the cultural narrative that our sexuality should politely fade into irrelevance somewhere between menopause and retirement, we're not just losing pleasure. We're actively compromising our physical health, our mental health, our cardiovascular function, our cognitive vitality, our pelvic floor integrity, and our overall quality of life. I want to introduce you to someone I'll call Margaret. She came to me at 63, referred by her primary care physician for recurrent urinary tract infections. This was her 5th infection in 8 months, and the antibiotics, while temporarily effective, were creating their own cascade of problems. When I took her complete history, here's what I learned. Margaret had been widowed 4 years prior. She'd been in a loving marriage for 38 years. Since her husband's death, she'd experienced what she described as a complete shutdown of her sexual self. That chapter closed, she told me. And honestly, doctor, I was fine with it. One less thing to think about. Except she wasn't fine. Her body wasn't fine. The tissues of her vulva and vagina had become so atrophied, so devoid of adequate blood flow and natural lubrication, that they'd become vulnerable to bacterial colonization. Her pelvic floor muscles, no longer engaged through sexual activity or self-stimulation, had weakened to the point where stress incontinence was becoming a daily concern. She'd stopped going to her yoga class because she couldn't trust her bladder during downward dog. She'd begun limiting her fluid intake, which was creating its own health problems. Her world was contracting, and it had started with the decision, the culturally sanctioned, medically uninformed decision, to simply close the door on her sexuality. I'm going to pause here because I can feel some of you preparing your defenses. But, Dr. Montes, I'm not interested anymore. The desire just isn't there. It feels like too much effort for something that doesn't even appeal to me. I hear you. And I'm not here to tell you that you should feel desire you don't actually feel. That's not my role, and it wouldn't be helpful. What I am here to tell you is that the relationship between desire and physiology is far more complex and bidirectional than we've been led to believe. Desire doesn't always precede arousal. Sometimes, particularly after menopause, it works the other way around. Arousal can generate desire. Physical stimulation can awaken interest that you thought had permanently departed. And here's the critical part. Even in the absence of what we traditionally think of as desire, the physical act of self-stimulation, of bringing increased blood flow to your pelvic tissues, of activating those nerve pathways, of engaging your pelvic floor musculature, these actions have profound health benefits that exist completely independently of whether you experience them as pleasurable or not. Though I'll tell you this, most women, once they push through the initial resistance and reacquaint themselves with their bodies after a period of dormancy, are surprised to discover that the capacity for pleasure hasn't vanished. It's been waiting. Let me explain what's happening in your body right now, at this stage of your life, because understanding the physiology is essential to understanding why this matters so much. When estrogen levels decline during and after menopause, the effects on your genital tissues are profound. The vaginal walls become thinner, less elastic. The tissue loses its natural moisture. Blood flow to the pelvic region decreases. The labia may shrink. The vaginal opening may narrow. This process, called vulvovaginal atrophy or genitourinary syndrome of menopause, affects approximately 50 to 70% of postmenopausal women. But here's what's crucial. It's not inevitable, and it's not irreversible. Your vagina, your vulva, your clitoris, these are vascular structures. They respond to blood flow. They respond to stimulation. They respond to use. When you engage in sexual activity, whether with a partner or alone, you're bringing oxygen-rich blood to these tissues. You're maintaining their elasticity. You're preserving their function. You're literally keeping them alive and responsive. Think of it this way. If you broke your arm and wore a cast for 2 months, what would happen to those muscles? They would atrophy. They would weaken. When the cast came off, you'd need physical therapy to rebuild strength and flexibility. Your sexual anatomy operates on the same principle. Use it or lose it isn't a crude joke. It's physiological reality. And here's something else that doesn't get discussed nearly enough. The clitoris is the only organ in the human body that exists solely for pleasure, not reproduction, not survival, just pleasure. That's remarkable. That's worth thinking about. Your body came equipped with a structure whose entire evolutionary purpose is to provide you with pleasurable sensation. And unlike most other organs, the clitoris doesn't shrink with age. In fact, it may continue to grow slightly throughout your lifetime. The issue isn't that your capacity for pleasure has diminished. The issue is that we've been taught to ignore it, to minimize it, to treat it as an embarrassing vestige of youth rather than an integral part of our adult bodies. Let me take you back to Margaret for a moment. After that initial consultation, I prescribed vaginal estrogen, a topical treatment that's remarkably safe and effective for treating vulvovaginal atrophy. But I also had a different conversation with her, one that I suspect her previous doctors hadn't initiated. I asked her directly about masturbation. She looked startled, then embarrassed, then almost angry. "Doctor, I'm 63 years old. I'm a grandmother. That's not something I do." I asked her why not. She didn't have a good answer, beyond a vague sense that it was inappropriate, that she'd somehow be betraying her late husband's memory, that it felt juvenile or desperate or pathetic. These weren't her words, of course. She struggled to articulate the feeling. But I've heard variations of this speech so many times that I've come to recognize it as a kind of cultural script we've all memorized without realizing it. So I reframed the conversation. I explained that I was recommending masturbation not as a frivolous indulgence, but as a medical intervention, as a way to increase blood flow to her pelvic tissues, supporting the effectiveness of the topical estrogen, as a method for maintaining pelvic floor muscle tone, which would help with her incontinence. as a strategy for reducing her susceptibility to urinary tract infections by promoting healthier tissue integrity. I told her this was no different than recommending regular exercise for cardiovascular health or weight-bearing activity for bone density. She left that appointment with instructions to use the vaginal estrogen 3 times per week and to engage in clitoral stimulation, with or without penetration, at least twice per week. She looked at me like I'd asked her to take up hang gliding. But she came back 6 weeks later, and the change was remarkable, not just physically, although the improvements were significant: fewer UTI symptoms, better tissue health, improved bladder control. But there was something else. She seemed more present in her body, more comfortable in her own skin, less resigned to a diminished version of herself. "I didn't expect to enjoy it," she admitted, "but I do. And honestly, Dr. Montes, I feel angry that no one ever told me this, that I spent 4 years thinking this part of my life was just over. That anger is valid. It's justified. And it's exactly why I'm having this conversation with you now. Now, I know what some of you are thinking. You're partnered. You have a sexual relationship. This doesn't apply to you. Except here's the thing. Partnered sexual activity and self-stimulation serve different functions and provide different benefits. A sexual relationship with a partner involves emotional intimacy, communication, compromise, timing, coordination, sometimes performance pressure, sometimes physical limitations based on your partner's health or abilities. It's wonderful, it's valuable, it's important, but it's not the same as the relationship you have with your own body. Masturbation allows you to explore sensation without the variables of another person's needs or responses. It allows you to learn or relearn what feels good to you now. At this stage of your life, which may be very different from what felt good at 30 or 40, it allows you to maintain sexual function independently of your partner's health, interest level, or availability. And crucially, it removes the element of performance, of concern about how you look or sound or respond, allowing you to focus purely on your own physical sensations and pleasure. I have patients in their 70s and 80s who are discovering or rediscovering self-pleasure after decades of either never engaging in it or stopping at some point when they internalized the message that it was inappropriate. And I'll tell you, there's something profoundly moving about witnessing a woman in her 8th decade reclaim her right to pleasure, to sensation, to her own body as a source of joy rather than just a vehicle that carries her through her obligations. Let's talk about the brain for a moment, because the benefits of sexual activity and orgasm extend far beyond your pelvic region. When you experience arousal and orgasm, your brain releases a cascade of neurochemicals: dopamine, which is involved in pleasure and motivation; oxytocin, which promotes bonding and reduces stress; endorphins, which are natural pain relievers; and prolactin, which aids in relaxation and sleep. Orgasm also temporarily increases blood flow to your brain, supporting cognitive function. There's emerging research suggesting that regular sexual activity throughout the lifespan may have protective effects against cognitive decline. Think about that. We spend enormous amounts of money on supplements and brain training apps and elaborate exercise routines to preserve our cognitive function as we age. And here's a free, natural, pleasurable activity that supports brain health, and we've been taught to feel ashamed of it. The cardiovascular benefits are equally impressive. Sexual arousal and orgasm increase your heart rate and improve circulation. Some researchers compare the cardiovascular workout of orgasm to climbing 2 flights of stairs. It's not a substitute for regular exercise, but it's certainly a valuable addition to your overall health routine. And unlike many forms of exercise, it's something you can do regardless of mobility limitations, joint pain, or other physical challenges that might make traditional exercise difficult. Let me introduce you to another patient, a woman I'll call Diana. She came to me at 58, 3 years post-menopause, complaining of severe vaginal dryness that was making intercourse with her husband painful. They'd tried over-the-counter lubricants which helped somewhat but didn't address the underlying tissue changes. She'd started avoiding intimacy, which was creating tension in her marriage. Her husband, well-meaning but frustrated, had suggested that maybe she just wasn't attracted to him anymore. When I examined Diana, the atrophy was significant, but not irreversible. I started her on vaginal estrogen, prescribed a high-quality silicone-based lubricant for intercourse, and then asked about her solo sexual activity. She looked confused. "You mean, do I masturbate?" I confirmed. She shook her head. "Never, really, even when I was younger." It just wasn't something I did. I explained that one of the most effective ways to restore vaginal tissue health and maintain elasticity is through regular stimulation, and that doing this on her own, without the pressure of performance or partner involvement, would allow her to experiment with what felt comfortable and to rebuild her sexual response at her own pace. She was skeptical, but agreed to try. What happened over the next several months was illuminating. Diana discovered that when she removed the variable of her husband's presence and expectations, she could relax into her body in a way she never had before. She could take her time. She could explore different types of touch and pressure. She could stop and start without feeling guilty or self-conscious. And as her comfort with her own body increased, her ability to experience pleasure, both solo and partnered, expanded dramatically. But here's the part that surprised her most: the positive effects on her marriage. Because she was no longer approaching partnered sex from a place of anxiety and discomfort, she could be more present, more communicative about what felt good. The power dynamic shifted. She wasn't just receiving touch, she was directing it, based on knowledge of her own body that she'd acquired through self-exploration. Her husband, rather than feeling threatened or displaced, was relieved and grateful to have clearer guidance about what she needed. This is something I want to emphasize because there's a pervasive myth that masturbation is somehow a poor substitute for partnered sex, or an indication that something is wrong in your relationship. The reality is exactly the opposite. Women who have a healthy solo sexual practice typically report more satisfying partnered sexual experiences. They know their bodies better. They can communicate their needs more clearly. They approach intimacy from a place of agency rather than obligation. And for women who aren't currently partnered, whether by choice or circumstance, masturbation isn't a consolation prize or a sad substitute for the real thing. It's a complete, valuable form of sexual expression in its own right. It's how you maintain your sexual health and function. It's how you stay connected to your body as a source of pleasure rather than just utility. It's how you refuse to let your sexuality be defined by the presence or absence of another person. I want to address something that comes up frequently in my practice: the challenge of reduced sensitivity. Many women in their 60s report that their clitoris is less responsive than it used to be, that it takes longer to become aroused, that orgasm is more elusive or less intense. This is real. It's a documented effect of hormonal changes and aging. But it's not a dead end. First, understand that reduced sensitivity doesn't mean absent sensitivity. It means you may need to adjust your approach. What worked at 40 might not work at 65. You might need more direct stimulation. You might need to experiment with vibration, which can provide more intense sensation when manual stimulation isn't sufficient. You might need to extend the time you spend in self-stimulation, allowing your body more time to build arousal gradually. This is where vibrators become not just acceptable but medically advisable. And I'm going to say something that might sound surprising coming from a physician. If you're over 60 and you don't own a quality vibrator, I want you to consider purchasing one. Not because you're broken and need fixing, but because it's a tool that can significantly enhance your sexual health and function. The market for sexual wellness devices has expanded dramatically in recent years, and there are now products designed specifically for older women, with features like ergonomic grips for arthritic hands, medical-grade silicone, and controls that are easy to see and operate. These aren't the cartoonish, embarrassing products of previous generations. They're sophisticated, body-safe devices that many pelvic floor physical therapists and gynecologists actively recommend. I have a patient in her 70s, we'll call her Ruth, who came to me for a routine checkup and casually mentioned that she'd purchased her first vibrator 6 months earlier. She'd been prompted by a conversation with a friend who'd given her one as a birthday gift of all things. Ruth was initially mortified, then curious, then delighted. "Dr. Montes," she told me, "I had my first orgasm in probably 15 years. I didn't even know that was still possible." The health improvements that followed were measurable: better sleep, reduced anxiety, improved mood, better vaginal tissue health. She also mentioned, somewhat shyly, that she felt more confident, more embodied, more like herself. "I didn't realize how much I'd been living from the neck up," she said, ignoring everything below. This phrase has stayed with me, living from the neck up. It's such an accurate description of what happens when we disconnect from our bodies, when we treat them as embarrassing encumbrances rather than integral parts of ourselves. And it's not just about sex. Women who maintain a connection to their bodies as sources of pleasure and sensation tend to be better at recognizing other physical signals: pain, fatigue, hunger, stress. They're better at self-care because they're actually present in the bodies they're caring for. Let's talk about pain, because this is crucial. If self-stimulation or penetration causes pain, that's important information. Don't ignore it. Don't accept it as inevitable. Pain during sexual activity is not a normal part of aging. It's a signal that something needs attention. The most common causes of painful sexual activity after menopause are vulvovaginal atrophy, pelvic floor dysfunction, and inadequate lubrication. All of these are treatable. Vaginal estrogen, which I've mentioned before, is remarkably effective for atrophy and can be used safely by most women, including many women with a history of hormone-sensitive cancers. Pelvic floor physical therapy can address muscle dysfunction. High-quality lubricants, and I mean real substantial lubricants, not drugstore products that contain irritating ingredients, can make an enormous difference. But here's what I need you to understand. Addressing these issues requires acknowledging them first. It requires believing that your sexual comfort and pleasure matter enough to seek treatment, and this is where so many women get stuck. They've internalized the message that sexual concerns aren't serious medical issues, that complaining about painful sex at 65 is somehow frivolous or inappropriate, that doctors will dismiss them or judge them. I'm here to tell you that any physician who dismisses your sexual health concerns is failing in their duty to provide comprehensive care. Sexual health is health. Your comfort, your pleasure, your ability to inhabit your body without pain. These are legitimate medical concerns that deserve professional attention. If your doctor seems uncomfortable discussing these issues or suggests that painful sex is just something you have to accept, find a different doctor. Preferably one who specializes in menopause medicine or sexual health. They exist. They're out there. You deserve care from someone who takes your concerns seriously. I want to circle back to something I mentioned earlier, the idea that masturbation in older age is somehow betraying a deceased spouse's memory. This comes up with surprising frequency in my practice, and it deserves direct attention. If you've lost a partner, particularly a long-term partner with whom you shared a sexual relationship, the grief is profound and multifaceted, and part of that grief often involves guilt about continuing your life in ways that feel like moving on or moving away from the person you've lost. Experiencing pleasure, particularly sexual pleasure, can feel like disloyalty, like evidence that you've forgotten or that they didn't matter enough. But here's what I want you to consider. If your late partner loved you, truly loved you, would they want you to spend the rest of your life disconnected from pleasure and sensation? Would they want you to experience pain and dysfunction out of some misguided sense of romantic fidelity? Would they want your body to atrophy and suffer because maintaining its health felt like betrayal? I suspect not. I suspect they would want you to be as healthy, as comfortable, as vital as possible for as long as possible. And your sexual health is part of that vitality. Continuing to care for your sexual self after loss isn't betrayal. It's honoring the part of yourself that your partner loved, the part of you that's fully alive and embodied and capable of sensation and pleasure. It's refusing to become a monument to your grief, rather than a living person navigating loss while still being present in your life. This doesn't mean you're ready for new partnerships. It doesn't mean you have to be. Your relationship with your own body can be complete and fulfilling on its own terms. And if and when you do choose to be intimate with a new partner, that doesn't erase or diminish what you had before. Love isn't a finite resource. Your capacity for connection, for pleasure, for intimacy, it doesn't run out. Let me shift gears slightly and talk about something that doesn't get nearly enough attention: the relationship between sexual health and mental health in older women. Depression rates increase after menopause, and while there are multiple contributing factors, hormonal changes, life transitions, loss of identity, social isolation, the loss of sexual vitality is a significant and often unacknowledged component. When you lose connection with your body as a source of pleasure, when you accept the narrative that your sexual self has expired, you're not just losing one aspect of your life, you're losing a fundamental way of experiencing aliveness, of feeling fully present in your body, of connecting with yourself as a sensual being. The psychological impact of this disconnection is real and profound. Orgasm, from a neurochemical perspective, is one of the most effective natural antidepressants and anxiolytics available. The release of endorphins and oxytocin, the temporary reduction in cortisol, the flood of dopamine. These aren't trivial effects. They're powerful modulators of mood and stress. When women maintain regular sexual activity, whether solo or partnered, they typically report better mood, lower anxiety, improved sleep, and greater overall life satisfaction. And yet, we've created a cultural context in which older women feel ashamed or embarrassed to prioritize their sexual health, as if caring about pleasure is somehow selfish or inappropriate. As if our bodies, once they've completed their reproductive mandate and weathered the transition of menopause, should quietly accept obsolescence. I refuse to accept that narrative, and I hope you'll refuse it too. I have a patient, let's call her Linda, who came to me at 61 with what she described as persistent low mood and anxiety. She'd been prescribed an antidepressant by her primary care physician, which had helped somewhat but hadn't resolved her symptoms. When I took a complete history, here's what emerged. Linda had been divorced for 6 years. She'd been in one brief relationship since then, which had ended badly. She'd essentially written off the possibility of future romantic or sexual relationships. "I'm too old," she told me. "Too much baggage, too much wear and tear. Who's going to want this?" The self-deprecation was painful to hear, but it was familiar. I can't tell you how many women in their 50s, 60s, 70s I've heard express similar sentiments, as if their value as human beings, their desirability, their right to pleasure and connection, all have an expiration date stamped somewhere around menopause. I asked Linda about her solo sexual activity. She looked surprised. "I don't do that, doctor. I'm not in a relationship." As if sexual expression was only valid in the context of partnership, as if her body only mattered when someone else was paying attention to it. We talked for a long time that day. I explained the connection between sexual activity and mood regulation. I suggested that experimenting with self-stimulation might be a valuable component of her treatment, working alongside the antidepressant to address her symptoms from multiple angles. She was resistant initially, but she agreed to try. When she returned 2 months later, the change was remarkable. The persistent anxiety that had been her constant companion had diminished significantly. She was sleeping better. She reported feeling more optimistic, more engaged with her life. And she said something that has stayed with me. "I didn't realize how much I'd been treating my body like an abandoned building, just letting it decay because I thought no one would ever care about it again, including me." This metaphor is heartbreaking and accurate. We learn to treat our bodies like abandoned buildings when we internalize the cultural message that our value is tied to youth and fertility and conventional attractiveness. When we no longer meet those criteria, and let's be honest, those criteria are impossible for any real woman to meet sustainably, we're left feeling like we no longer merit care, attention, or investment. But here's the truth: your body is not an abandoned building. It's your home. It's where you live every single day of your life, and it deserves care, attention, maintenance, and yes, pleasure, regardless of who else is or isn't paying attention to it. I want to address another concern that comes up frequently: the fear that focusing on self-pleasure is somehow selfish, indulgent, or evidence of unhealthy self-absorption. This concern is almost exclusively expressed by women. Male patients, across all age groups, generally don't seem to carry this guilt about attending to their sexual needs. So, let me be very clear: taking care of your sexual health is not selfish. It's self-care, and self-care is not indulgence. It's maintenance. It's how you ensure that you can continue to show up for all the people and responsibilities in your life from a place of wholeness rather than depletion. You cannot pour from an empty cup, as the saying goes, and you cannot be fully present for others when you've abandoned yourself, when you've relegated your own needs to some category of frivolous wants that don't deserve attention. Women, particularly women of our generation, have been socialized to believe that our needs should always come last, that attention to our own pleasure or comfort is something to feel guilty about, that we should be perpetually available for everyone else's needs while neglecting our own. This isn't virtue. It's learned self-abandonment, and it doesn't serve anyone, least of all you. When you take care of your sexual health, when you maintain connection with your body as a source of pleasure and vitality, you're not taking something away from anyone else. You're ensuring that you're healthier, more balanced, more present, more vital. That benefits everyone in your life. Let's talk practically for a moment about how to actually approach this if you've never masturbated or if you haven't in many years. Because I recognize that for many of you, there's a gap between understanding intellectually why this matters and actually implementing it in your life. First, create privacy and time. This isn't something to rush through in the 5 minutes before someone comes home or between errands. Set aside actual time when you can be alone, unhurried, and free from interruption. Lock the door if you need to. Let calls go to voicemail. Give yourself permission to be unavailable for a while. Second, let go of any preconceived notions about what this should look like or how long it should take or what the outcome should be. You're not trying to achieve anything. You're exploring. You're reacquainting yourself with your body. Maybe you'll experience pleasure. Maybe you'll experience orgasm. Maybe you won't. All of those outcomes are fine. The goal is simply to be present in your body, to attend to sensation, to see what feels good. Third, use lubricant. I cannot emphasize this enough. Even if you think you don't need it, use it anyway. Adequate lubrication protects tissue, enhances sensation, and makes the experience more comfortable. I recommend silicone-based lubricants over water-based ones for most women, as they last longer and don't get sticky or tacky. And please, use products designed for intimate use, not random household items. Fourth, take your time. Arousal in midlife and beyond often builds more slowly than it did in your younger years. That's normal. It's not a failure. It doesn't mean something is wrong. It just means you need to adjust your expectations and your approach. Spend time on your whole body, not just your genitals. Touch your breasts, your thighs, your abdomen. Notice what feels good. Build sensation gradually. Fifth, consider using a vibrator. As I mentioned earlier, many women find that vibration provides more intense, more reliable stimulation than manual touch alone, particularly if sensitivity has decreased. There are countless options available online, ranging from simple, affordable designs to more elaborate devices. Start simple if you're new to this. Sixth, and this is crucial, if you experience pain at any point, stop. Pain is information. It's your body telling you that something needs attention. Don't push through it. Don't accept it as inevitable. If self-stimulation is consistently painful, that's something to discuss with your healthcare provider. There are solutions, but you need to seek them out. Seventh, manage your expectations about orgasm. For some women, particularly those who've gone years without sexual activity or who are dealing with significant hormonal changes, orgasm may be elusive at first. That doesn't mean it's impossible. It doesn't mean you're broken. It may mean you need more time, different stimulation, a vibrator, or medical intervention to address underlying issues. But even in the absence of orgasm, the act of self-stimulation has health benefits. The increased blood flow, the muscle engagement, the sensory attention, these all matter. And finally, be patient and compassionate with yourself. If this feels awkward or strange or uncomfortable at first, that's okay. You're unlearning decades of cultural messaging that taught you to ignore or be ashamed of your sexuality. You're rebuilding a relationship with your body that may have been dormant for years. That takes time. It takes practice. Give yourself grace. I want to share one more patient story with you. A woman I'll call Elizabeth came to me at 68 with severe vaginal atrophy and recurrent infections. She'd been sexually inactive for over a decade following the end of a long, unhappy marriage. When I recommended vaginal estrogen and discussed the importance of regular stimulation to improve tissue health, she was initially receptive. But when she returned for her follow-up appointment, she confessed that she hadn't been able to follow through. "I tried," she said. "I got the prescription filled. I bought the vibrator you recommended. But when I actually sat down to do it, I just felt ridiculous. Like some desperate old woman pretending to be young. I couldn't get past the feeling that this was pathetic." I appreciated her honesty. And I asked her a question. "Elizabeth, if I told you that you needed to do pelvic floor exercises to prevent incontinence, would you feel ridiculous doing those? Would you feel pathetic?" She thought about it. "No, that's medical. That's different." "How is it different?" I asked. "Both are interventions designed to maintain the health and function of your pelvic tissues. Both involve deliberate attention to a part of your body you're used to ignoring. The only difference is the cultural baggage we've attached to one and not the other." This conversation seemed to shift something for Elizabeth. She came back 6 months later with significant improvement in her symptoms and a completely different attitude. "I stopped thinking of it as some kind of sexual act," she told me, "and started thinking of it as physical therapy. And that made it manageable, and then after a while, it stopped feeling like work and started feeling like something I actually wanted to do, not because I had to, but because I enjoyed it." This reframing can be powerful. If thinking of masturbation as a sexual activity carries too much psychological weight, think of it as pelvic physical therapy. Think of it as preventive medicine. Think of it as cardiovascular exercise. Think of it however you need to think of it to make it approachable. And then, if and when it evolves into something you experience as pleasurable rather than medicinal, let that be a bonus rather than the goal. Now, I want to address a question I get asked frequently. What about women who've never experienced orgasm or who've had extremely limited sexual experience throughout their lives? Is it too late to develop this capacity in your 60s or 70s? The short answer is no, it's not too late. The longer answer is that it may require patience, education, possibly medical intervention, and a willingness to explore your body in ways you never have before. But it's absolutely possible. The clitoris has approximately 8,000 nerve endings, twice as many as the penis. It's an exquisitely sensitive organ designed for pleasure. The fact that many women have never learned to stimulate it effectively or have been taught to feel shame about it doesn't mean the capacity isn't there. I've worked with women in their 70s and 80s who've experienced their first orgasms with the help of education, appropriate medical treatment for any underlying issues, and a quality vibrator. Is it common? Perhaps not. But it's absolutely possible, and the women who've had this experience late in life describe it as revelatory, as a kind of reclamation of a part of themselves they thought was forever lost or never existed. Even if orgasm doesn't happen, learning to experience pleasure, to connect with your body as a source of good sensation, to feel fully embodied and present, these are valuable outcomes in themselves. We've become so goal-oriented, so focused on orgasm as the sole marker of successful sexual experience, that we've lost sight of the value of pleasure and sensation for their own sake. Let me pivot slightly and talk about relationships, because I know many of you listening are in long-term partnerships, and you may be wondering how to navigate this conversation with your partner, or whether you even need to. First, let me say that your solo sexual practice is yours. You're not obligated to discuss it with your partner if you don't want to. It's not a betrayal of your relationship. It's not something you need permission for. Your body belongs to you, not to your partnership. That said, for many women, incorporating conversations about self-pleasure into their relationship can actually enhance intimacy and improve their partnered sexual experiences. When you know your own body well, when you've figured out what feels good to you now at this stage of your life, you can communicate that information to your partner. You can guide them. You can ask for what you need with confidence because you know what you need. Some couples find it intensely erotic to incorporate masturbation into their partnered intimacy, either by masturbating together or by one partner watching the other. This removes any sense of threat or competition, and instead frames solo pleasure as an extension of shared intimacy. But if that doesn't appeal to you, if you prefer to keep your solo practice private, that's equally valid. The key is that you're tending to your sexual health in whatever way works for you, not abandoning it out of shame or neglect. For women who are currently single, whether by choice or circumstance, I want to emphasize again that self-pleasure isn't a poor substitute for partnered sex. It's a complete, legitimate, valuable form of sexual expression. And maintaining your sexual health and function through solo practice means that if and when you do choose to be intimate with a partner, you'll be approaching that intimacy from a place of confidence and knowledge rather than anxiety and uncertainty. I've had patients tell me that rediscovering their sexuality solo after years of unsatisfying partnered sex was actually liberating. One woman in her early 60s told me, "I finally figured out what I like, without anyone else's ego or agenda in the room, and now I know that if I do decide to date again, I'm not going to settle for bad sex. I know better now." This is empowerment. This is agency. This is refusing to let your sexuality be defined or limited by anyone else's participation or approval. Let's talk about the intersection of sexual health and other chronic health conditions, because this is reality for many women in their 60s and beyond. You may be managing diabetes, hypertension, arthritis, heart disease, or any number of other conditions that affect your energy, mobility, or overall well-being. And you may be thinking that adding sexual health to your list of concerns feels overwhelming or even impossible. But here's what I want you to understand. In many cases, attending to your sexual health can actually support your management of other chronic conditions. Regular sexual activity, including masturbation, has been shown to help regulate blood pressure, improve circulation, reduce inflammation, support immune function, and promote better sleep. All of these effects can positively impact chronic disease management. Yes, certain conditions and medications can make sexual activity more challenging. Diabetes, for example, can affect nerve function and blood flow, making arousal more difficult. Some blood pressure medications can reduce libido or interfere with sexual response. Arthritis can make certain positions or movements painful, but challenging doesn't mean impossible. It means you may need to adapt. You may need to experiment with different positions, different types of stimulation, different timing in relation to medication schedules. You may need to use assistive devices like vibrators or ergonomic aids. You may need to communicate with your healthcare providers about adjusting medications if sexual side effects are impacting your quality of life. The point is that chronic illness doesn't automatically mean the end of your sexual life. It means you need to approach it thoughtfully, with appropriate medical support and a willingness to adapt. And often the effort is worth it because the quality of life improvements that come from maintaining sexual health can be significant even in the context of other health challenges. I want to address something else that comes up frequently: body image concerns. Many women tell me they can't imagine being sexual with a partner or alone because they're so uncomfortable with how their bodies look now compared to how they looked at 40 or 50. The weight gain, the sagging, the scars, the visible evidence of decades lived, and I want to say this as clearly as I can: your body is not an ornament. It's not a decoration meant to please someone else's aesthetic preferences. It's the vehicle through which you experience your entire life. It's carried you through childbirth or chosen not to. It's healed from surgeries and illnesses. It's moved you through the world for 6 or 7 or 8 decades. It's remarkable. The cultural obsession with youth and conventional attractiveness is designed to make you feel inadequate, so you'll keep buying products and services promising to make you acceptable. Don't participate in that game. Your body, exactly as it is right now, is worthy of pleasure, care, and attention. Not despite its age or changes, but inclusive of them. When you're alone, engaged in self-stimulation, no one is looking at you. No one is judging your appearance. It's just you and your sensations. And in that private space, your body image concerns become irrelevant. What matters is how your body feels, not how it looks. If you can gradually rebuild that sense of your body as a source of sensation and pleasure rather than an object to be visually evaluated, it can actually help shift your body image concerns in other contexts as well. When you inhabit your body fully, when you're present in it rather than observing it from a critical distance, the obsession with appearance tends to diminish naturally. I want to circle back to something I touched on earlier but want to explore more fully: the use of vaginal estrogen. This is such a safe, effective, underutilized treatment that I sometimes feel like I'm shouting into a void trying to get more women to consider it. Vaginal estrogen is different from systemic hormone replacement therapy. It's applied directly to the vaginal tissues, and very little is absorbed into your bloodstream. This means it can be used safely by most women, including many women with a history of breast cancer or other hormone-sensitive cancers, though you should absolutely discuss this with your oncologist if that applies to you. The effects of vaginal estrogen on tissue health are dramatic: thicker, more elastic vaginal walls, better natural lubrication, healthier pH balance, which reduces susceptibility to infections, improved blood flow, reduced pain during intercourse or other penetrative activity. It typically takes several weeks to start seeing effects, and optimal benefits may take a few months, but the improvement is real and measurable. If you're experiencing vaginal dryness, painful intercourse, recurrent urinary tract infections, or other symptoms of vulvovaginal atrophy, please talk to your healthcare provider about vaginal estrogen. It's available in several forms: creams, tablets, rings, and most women find one of these options tolerable and easy to use. And here's the thing: vaginal estrogen works best when combined with regular sexual activity or stimulation. The estrogen improves tissue health, and the stimulation maintains blood flow and elasticity. They're complementary interventions. You're not choosing one or the other, you're using both together for optimal results. Let's talk about something that rarely gets discussed openly: the grief that some women feel when they realize how much time they've lost, how many years they spent disconnected from their sexuality because no one told them it mattered, because they internalized all the cultural messages about aging and women and sexuality, because they thought this part of their life was just over. That grief is real and valid, and I want to acknowledge it without dwelling in it, because here's the thing: you can't get those years back. None of us can. But you can decide what to do with the years ahead. You can decide whether to continue accepting a diminished version of yourself or to reclaim this part of your life that you thought was lost. Yes, it would have been better if someone had told you all of this 20 years ago. It would have been better if your doctors had discussed sexual health as routinely as they discussed cholesterol and blood pressure. It would have been better if our culture didn't treat female sexuality as something that expires at menopause. But better late than never is not just a platitude, it's a genuine possibility. You can start now, today. 65 is not too late. 70 is not too late. 80 is not too late. As long as you're alive and inhabiting a body, that body deserves care, attention, and yes, pleasure. So feel the grief if you need to. Acknowledge the loss. Be angry if that's what comes up, but then decide to move forward. Decide that you're worth the effort of relearning your body, of reclaiming your sexuality, of refusing to accept the narrative that this part of your life is over. I want to share something personal for a moment. I chose to specialize in women's health and sexual medicine in part because I watched my own mother navigate menopause and the years beyond with absolutely no medical support for the sexual health challenges she was experiencing. She suffered in silence with vaginal atrophy, painful intercourse, and recurrent infections because she was too embarrassed to bring it up with her doctor and because her doctor never asked. By the time I was in medical school and starting to understand these issues, she'd been suffering for years. And when I tried to talk to her about it, to tell her there were treatments available, she dismissed it. "It's fine," she said. "I'm too old for that to matter anymore." But it did matter. It mattered that she was in pain. It mattered that her quality of life was diminished. It mattered that she'd accepted suffering as inevitable when it absolutely wasn't. I couldn't help my mother. She'd internalized the shame too deeply, and by the time I had the knowledge and credentials to really advocate for her, she'd closed that door firmly. She died at 73, and I'll always wonder what those last years of her life might have been like if she'd been willing to address her sexual health, if she'd believed she was worth that care. I don't want that for you. I don't want you to spend the next decade or 2 or 3 accepting pain, accepting disconnection from your body, accepting a version of yourself that's smaller and more diminished than it needs to be. You deserve better. Your body deserves better. So here's what I'm asking you to do. Here's my clinical recommendation, my prescription, if you will. This week I want you to set aside 30 minutes of private, uninterrupted time. Lock the door, silence your phone, get comfortable. And I want you to explore your body with curiosity and without judgment. Touch yourself. Notice what feels good. Pay attention to sensation. You're not trying to achieve orgasm. You're not trying to recreate any past sexual experience. You're simply reacquainting yourself with your body as it exists right now, in this moment. If you haven't been sexually active in years, this might feel awkward or strange. That's okay. Do it anyway. If you've never masturbated before, if you've always thought it was shameful or inappropriate, I'm giving you medical permission. This is healthcare. This is preventive medicine. This is how you maintain the health and function of your pelvic tissues. And if you discover that you're experiencing pain, or that the tissue health is so compromised that touch is uncomfortable, that's valuable information. Make an appointment with your gynecologist or a menopause specialist. Get evaluated. Get treatment. Don't accept pain or dysfunction as inevitable. Your sexual health matters. Your pleasure matters. Your right to inhabit your body fully, without pain, without shame, without the sense that this part of you is supposed to quietly disappear, that matters. I know I'm being forceful about this. I know I started this conversation by saying I'm imploring you, and I mean it. Because I've seen too many women suffer needlessly. I've seen too many women accept a diminished quality of life because they thought their sexual health didn't matter anymore, or because they were too embarrassed to seek help, or because no one ever told them that the changes they were experiencing were treatable. I've also seen the transformation that's possible when women reclaim this part of themselves, the improvements in physical health, better tissue integrity, fewer infections, improved pelvic floor function, better sleep, the improvements in mental health, reduced anxiety and depression, better mood regulation, improved self-esteem, the improvements in relationships, whether with long-term partners or new connections, and perhaps most importantly, the improvement in how women relate to themselves, to their own bodies, to their sense of their right to take up space and experience pleasure, and refuse to apologize for having needs. This isn't a trivial concern. This isn't vanity. This is fundamental to your well-being. So I'm going to ask you again. Subscribe to this channel if you haven't already. Share this video with other women in your life who might need to hear this message. Comment below and tell me, has anyone ever made you believe that your sexuality had an expiration date? Let's start breaking down that myth together. You are not too old. Your body is not too damaged. It is not too late. You are worthy of pleasure, of care, of a full, embodied life that includes sexuality and sensation and all the physical pleasures that your remarkable body is capable of experiencing. This is Dr. Valeria Montes, reminding you that health includes sexual health, that care includes self-pleasure, and that you deserve to feel fully alive in your body for every single day you have left on this earth. Take care of yourself, and I mean that in the fullest, most complete sense.